So without further ado, I'd like to introduce and delighted to be joined by Dr. Liz O'Riordan, who is a speaker, author of 2 books, Under the Knife and The Complete Guide to Breast Cancer, podcast host to So Now I've Got Breast Cancer, and does a fantastic YouTube channel and Instagram, which is sort of giving lots of information. And just, I've probably forgotten, Liz O'Riordan was a breast surgeon and has also had her own diagnosis of breast cancer. So I will sort of over to you, Liz, to say hello and good evening, and then we'll get on with tonight's session.
Hi everyone, it's great to be here with you all, and I'm thrilled to be able to answer some of the common myths that I had when I was a patient that I get asked every day about. So thank you so much, Louise and Breast Cancer Now, for having me.
And I think you're absolutely right. I think after a breast cancer diagnosis, we certainly hear on our helpline and our Ask Our Nurse service so often with people saying, what should I eat after a diagnosis? What should I avoid? Some of the myths as to what caused my breast cancer, or what do I need to not do to cause it coming back? And supplements is another big one. So I think first we'll get started on the myth busting, really. I think one of the ones that comes up is deodorant. Is it anything behind that, Liz?
I couldn't believe it when people said, is it safe to wear deodorants after breast cancer? And I think the myth comes from the fact that we ask you not to wear them when you have a mammogram, and we often ask you not to wear them when you're having radiotherapy. And the reason is the tiny chemicals in the dust and the powder from deodorants can cause white flecks on a mammogram. So that means they're not read accurately. We can mistake things that aren't there. And with radiotherapy, your skin can be very, very sensitive and raw. So we don't want you using anything with chemicals in. We say natural deodorants. And a lot of people assume that you can't use deodorants for life. The theory is that when you sweat and you use a deodorant or antiperspirant, it blocks your sweat glands, and that stops toxins being drained. So toxins then go back to your breast, and that causes breast cancer. And it's BS. Your sweat glands just produce sweat. They have nothing to do with lymph. Lymph doesn't store itself in your breast. It's all rubbish. The other theory is that the aluminium in antiperspirants is absorbed at huge toxic levels, all because of a study that found aluminium in breast cancer cells of patients. But the person who did the study said, this doesn't mean it caused breast cancer. This is just an observation. But people have taken that up to sell natural deodorants and natural antiperspirants. You can wear and use whatever you like. They do not cause breast cancer, and they will not make it come back.
Great, thank you. And the next one, again, I would say less common, but still comes up from time to time, is bras, particularly underwired sometimes.
And there are companies who keep saying that they're working with you, Breast Cancer Now, by creating underwired bras. So this all started back in the 60s when 2 Americans who weren't doctors analysed a load of American women, and they found that those who had underwired bras were more likely to get breast cancer. Therefore, underwired bras cause breast cancer, and it's bad biology. They said the bras sit on your chest wall, that compresses the breast tissue, which creates toxins building up and causes breast cancer. It is absolutely rubbish. Bras are completely safe, and actually there's been one study that did look properly and found no evidence. Underwired bras are often uncomfortable and painful, and the first thing you want to do when you get home at the end of the day is rip yours off, and that just means they don't fit you properly. I thought I was a 34A, and when I got measured I was a 30D, because most of our breasts go all the way around underneath our armpit. And the minute you get a bra that fits you properly, suddenly that pain goes. So you can wear whatever you like. After you've had breast cancer surgery, we generally say wait 6 to 8 weeks. And that's just to let all the jiggery pokery we do inside to move the tissue around settle and heal. And then you can wear what you like.
Great, thank you. And just if anyone's wanting information about a well-fitting bra, we do have information on our website about that, and also bras sort of in the 12 months after surgery. So again, but I do know that finding a well-fitting bra after various types of breast surgery can be a real issue for some. I think the next one, again, which comes up is mammograms.
Yes, I've just done a couple of videos on these, and I've had death threats and trolls from people. It's really divisive because there are 2 schools of thought in the scientific community. One that thinks they're great and one that thinks they're dangerous and should be banned. The breast cancer screening website, the NHS breast cancer screening, has all the advice there. They are the best tool that we have for finding breast cancer. Some breast cancers are missed, like lobular cancers, which is what I had, because they grow in sheets, not clumps. they can cause breast cancer, but the risk of breast cancer is about 1 in 30,000 from a tiny increased dose of radiation if you have your mammograms year in, year out from the age of 50 to 70. But your risk of getting breast cancer when you're 50 is like 1 in 40. So the risk from a mammogram of getting breast cancer is absolutely tiny. Yeah. Thermography doesn't work. It doesn't pick up breast cancers. MRIs and ultrasounds aren't good for screening. It's the only tool we have. And I'm really concerned, Louise, because we know that in some areas, only a third of women are going for their mammograms. Yeah. And they don't save a lot of lives, but they do reduce the amount of treatment that a lot of women need. If your cancer is caught at an early stage, you are less likely to need a mastectomy. You are less likely to need chemotherapy. So I think they are a brilliant tool for trying to prevent breast cancer deaths and mortality. But you'll find other doctors who disagree with me, and it's really hard to know who to believe when there's so much contradiction online.
Yeah, and we were just talking about that before we came live on air, weren't we, about sort of it's that sort of Dr. Google, and who do you trust, and who's out there, and what information, so it can be a complete minefield. Thank you for that. So, and I think the next one is parabens, and for those that maybe haven't heard that term used, it's sort of the chemical compounds that can be found in some cosmetics, makeup, face and body creams and lotions, shampoos, conditioners. So it's found in lots of products we use, and it's another common query we get from some people that just say, is it safe to use? Do I need to throw all my makeup away and go sort of completely natural?
There is a huge wave of clean, natural, safe cosmetics toiletries for cancer patients. Throw all the toxins away. The toxins cause your cancer. Parabens are preservatives that are put in almost every toiletry you use. Makeup, moisturiser, skincare. They stop it being infected with bacteria and fungi. Because when you open your face cream and you put your fingers in that you haven't washed to put on your face, and then you don't wash them and put them back, it stops stuff growing. It gives them the shelf life. They are completely safe. And actually, the things you have to put in products that don't have parabens are often quite strong acids and alkalis. The shelf life isn't as good. They don't last as long. And penicillins and molds have been found growing in them. There is no evidence, and I've just researched this, that parabens, the preservatives and chemicals in toiletries, cause cancer. They are safe. If you want to go all natural because you feel better, that is fine. But don't throw everything away because you're scared it's going to make your cancer come back.
Great. Thank you. So I think moving on to such a big topic, which is sort of vitamin and herbal supplements. Yeah. And I would say we certainly get query after query about sort of what can I take? And I think there's varying reasons as to why people want. They either want to take back some control, or it might be to help manage some of the side effects that they might be, for example, sort of menopausal symptoms from hormone treatment. So I think one of the sort of the hot topics at the moment we get a lot about is collagen, and whether or not that's safe.
Yeah. And I think the first question to ask is, why do you want to take collagen, and what do you think it's going to do? Collagen is the thing in our body that gives structure to our hair, our nails, our skin, our tendons, our joints. And collagen is made up of amino acids, which are like the Lego blocks of proteins that form everything. And if you eat a normal, healthy diet with a good protein source, you will get all the collagen you need. The problem is collagen gets damaged over the years. Like me in my 20s, I never wore sunscreen, I got burnt, I didn't drink enough water, I didn't moisturize every day, I did not do the things my mum told me to. And now I'm nearly 50, I have the damage. I've got the wrinkly skin and your hair gets weak. It's natural aging process. People want to buy collagen supplements to look like the women selling them. They think it's going to miraculously make them feel better and look better. There's two problems with this. Collagen that you buy is made from the breakdown leftover products of animal and fish processing. So all the bits that are swept onto the factory floor, the bits of bones and skin and gristle, they are ground down to form collagen powders, unless you're paying a lot of money for vegan and algae collagen powders. And you can take that collagen powder, but your body breaks it down into Lego building blocks, and you have no control over whether those building blocks go to your skin and your nails or go to your joints. So if you're taking it for your hair may not be affected because your body needs it somewhere else. It is safe to take. It won't interfere with any of the breast cancer treatments. You're probably better off using sunscreen, eating fruit and veg and moisturising. But if you want to take it, that's fine. Just be aware of where you're getting the collagen from, because you might be surprised to see what you're actually taking.
And I should have said just before I start, and certainly from our point of breast cancer now, we would always signpost back to treatment teams and or pharmacists just to check if you are on medication, ongoing treatments, that there isn't any reason why they might think for your individual situation you shouldn't be on.
Yeah, that's really important.
The next one we got asked about is supplements for hair thinning. And again, it's a real range. It's certain shampoos. Is there a supplement that will make my hair grow quicker? And I think it's a really difficult one.
I feel your pain. I've had chemotherapy and I lost my hair and it came back. And I've always had big, thick hair. But now I'm on palbociclib and Faslodex. I've got hair thinning, and women get hair thinning on the crown. I only wash my hair once a week because it just comes out. I did a podcast with the incredible Jasmine Julia Gupta, who's the founder of the Cancer Hair Care Charity. She is fab. Her team are great. You can find them and ask them for advice. And we said basically what your hair needs is fruit and vegetables and protein. The best thing you can take for your hair is a really good, well-balanced, healthy diet. You're going to hear this a lot and it's going to sound boring. It can be hard and expensive to cook your fruit and veg and do that. So a general common multivitamin that you'd get anywhere is a safe way of making sure you're getting all the things that your hair needs. There are treatments you can get called minoxidil that can sometimes help boost that hair growth. You can get them from doctors and hair specialists, but when you stop using them, your hair will start falling out again. I don't know whether shampoos and things work. Again, who knows what a person's diet is or whether they're sleeping, and it's hard to know if the shampoo itself is doing it. There's no harm in trying them. You won't hurt your hair, but the most important thing is to make sure you're getting all the vitamins and minerals you need from either a diet or a vitamin supplement. It's really tough. It's really unfair that it happens, especially with the menopause. And I know several of my relatives have resorted to wearing wigs and hair toppers because they're just too embarrassed to go out in public. It's really shit. And it's hard to fix.
Yeah. And Cancer Hair Care is a fantastic organisation. So thanks for mentioning that, because we've worked with Jasmine in the past. And just while we're on the supplements, Sarah's asking, what can you take to help with menopause symptoms if you're on letrozole? And again, it's a difficult one, isn't it? Because it may be what symptoms is Sarah experiencing.
So the first thing to say is, to help with the hot flushes and the night sweats, there are a lot of tablets that your GP can prescribe that will help with these symptoms. Now, they have another use. They are antidepressants, they are urology tablets, epileptic tablets, painkillers that work in two ways. You're not being given them because your doctor thinks you're mad. And I'm on an antidepressant and a heart pill to help with mine. One of the big things that can help with the symptoms of the menopause, and you're going to hate me again, is a healthy diet and exercise and good sleep, because they all really do help with the symptoms. Some people think that sage can help, sage supplements, but there's no one that'll tell you what the dose is and how much there is to take. There's not really one thing that's been proven to help. And the worry is a lot of things like black cohosh and St. John's wort can actually interfere with tamoxifen and the hormonal blocking medications. So you have to be really, really careful. Tamoxifen you take as a tablet, and when you break it down, it turns into a chemical that's 1,000 times more effective. And that's done by a group of enzymes. But St. John's wort and black cohosh and turmeric are all broken down by these enzymes. So if they're breaking down all these supplements, tamoxifen isn't being broken down, and that can increase your risk of recurrence. So you have to be really, really careful what you're taking. And the kicker is, most doctors like me won't have heard of half of these supplements, and the supplements get out clause is, ask your doctor if they're safe, and we just don't know. I think there really isn't one, sadly, that can help, and it's really, really hard.
And I suppose the other, what we often signpost to, and again, we can put the link in here, is the Memorial Sloan Kettering, which is a good signpost to go and sort of, they have a section with contraindications and different medical conditions that you may need to avoid. It's the starting block to have a look. And then again, as I say, you can go back to your treatment team. But I suppose the other thing, Liz, is that the vitamin and herbal supplements industry is not as regulated as the pharma industry, is it?
This is the thing. So supplements by law are not regulated. If you take paracetamol, you know it contains 500 milligrams of paracetamol. Supplements could contain talcum powder and tell you that they're vitamins. By law, they can have anything in them. They're not regulated. A third of the supplements bought on Amazon do not contain what they're meant to. A website can tell you it's made in our factory and it's all hermetically sealed, but that could be just bullshit marketing. You have no idea whether what you're getting is actually a supplement. And there is a huge placebo effect. When you take something that you think is going to make you better, you often feel better because you know it's going to make you better. And then you start exercising more or eating better or sleeping better, and the tablet may have nothing to do with it. I would say the only thing you need is a general multivitamin tablet, because it's hard to eat enough fruit and veg in a day, and a bone supplement diet tablet if you're on aromatase inhibitors.
Great. And I suppose the other thing for menopausal symptoms that we know can be helpful for hot flushes is cognitive behavioural therapy has been shown to be effective for some.
Yeah. And people think, God, you want me to talk about my hot flushes? But it does work, and it helps you find ways to deal with them. And also things like acupuncture and hypnotherapy can really, really help. And a lot of cancer centres, even my breast care nurse were trained in acupuncture. So it's worth just asking what is available where you're treated or in your local cancer centres. Yeah.
We've got information again. We've got a booklet called Managing Your Menopausal Symptoms and Breast Cancer. So do have a look on there, and it's got lots of different ways to manage menopausal symptoms. So I think the next question, turmeric.
Yes.
Is that safe to take?
Yes, that bright yellow spice. Turmeric in curries, in cooking, is absolutely fine. The active ingredient of turmeric is called curcumin or curcumin, and that's only about 3% of turmeric, and that's the active ingredient. And you don't absorb a lot of it. Most of what you eat gets peed out. So if you swallow a load of capsules, you don't absorb a lot of it. And it interacts with the enzymes that interfere with tamoxifen. So if you're on tamoxifen, you should not be taking turmeric supplements. It's meant to be a good anti-inflammatory to help with the aches and pains, but people believe it can cure cancer based on mice studies and cell studies in a lab. There is no human evidence to show that it can have any impact on breast cancer outcomes. And you would have to take like 6 jars of turmeric powder a day to get any effect. It doesn't work, but people are making billions. The wellness industry is worth $5-6 trillion at the moment, selling supplements on us because we're vulnerable. I want to do anything I can to stop my cancer coming back. And often spending 50 quid on a turmeric supplement makes me feel I'm doing something, like watching Davina's video eating a pack of chocolate biscuits thinking I'm now fit. It's like, oh, I've done something, it's fine. They don't work. Take them because you like the taste, but don't take them thinking your cancer is going to come back. And if you're on tamoxifen, avoid them completely.
Great, thank you. And just another question that's come in live. Sharif has asked, while we're on the subject of sort of tamoxifen, would evening primrose oil be okay to take with tamoxifen?
Oh, I honestly can't remember. I think it might interfere with tamoxifen, but I would need to go away and double check that.
I've got a feeling it does. And in fact, we do list it in our
you're right, it does.
There's a few, So I would probably say to avoid taking that.
You're right. Thank you, Louise.
And the other question that's come in live, and I know we've mentioned hair previously, but biotin for hair, is that something that you're aware of?
Biotin is one of the essential vitamins and minerals. It's one of the B vitamins that can really help. And again, if your diet isn't balanced, and again, I've eaten mostly bagels and toast today because I'm writing my 3rd book. If you're not getting a lot of fruit and veg and a rainbow of stuff, then a general multivitamin, doesn't need to be a special one, will have the biotin that you need to help your hair. So I would say a general multivitamin is a really good thing to have for anybody after a cancer diagnosis, because you all get days where you just can't be asked to cook properly.
Great, thank you. And then mushrooms. Weird and wonderful, all sorts of mushrooms comes up from time to time.
So I went viral debunking a video by The Happy Pear where a gynecologist said mushrooms cure cancer, and you've got medicinal mushrooms, and they prey on natural Eastern medicine techniques that doctors like me don't know. And again, I've just done a load of research into this. I'm just going to scroll back and open this up now. There is no evidence to show that medicinal mushrooms have any effect on cancer outcomes in humans. You can put highly doses of concentrated mushroom powder onto cells in a dish and kill them. Surprise, surprise. You can inject rats with huge amounts of mushroom powder. Rats are not little people. There is no evidence that they work. People are making millions of pounds selling you stuff. Mushrooms are great to have as part of your diet. They're full of loads of antioxidants and vitamins and minerals, but you don't need to spend your money buying supplements thinking they're going to cure your cancer or stop your cancer coming back.
Great, thank you. And then Sarah has asked, she's read that research says that vitamin E and omega-3 can help reduce neuropathy induced by paclitaxel chemotherapy, but her oncologist and pharmacist won't allow her to take it.
So I had a look at this for Sarah. There is a little bit of research to show that some vitamins and minerals may have a small impact on peripheral neuropathy, but it's not replicated. In a lot of studies, they have no effect. And the problem is vitamins can have a lot of antioxidants when their job is to mop up chemicals that can kill cells. But when you're having chemotherapy or other targeted treatments, we want those. We don't want them to be mopped up because we're creating chemicals that will kill the cells. So if you're having a load of antioxidants and vitamins, they're actually stopping your chemotherapy and targeted therapy working. We don't really know what the cause of peripheral neuropathy is. We don't know how to prevent it. We don't know how to cure it. And it's horrible when it happens. I mean, I thought I couldn't operate again when my fingers went numb. But it is really dangerous to have any vitamin or supplement during chemotherapy or targeted therapy. And that's why you have to check with your oncologist, because it's more important that we save your life. And these treatments can stop chemotherapy working. And I've seen it happen, and it's horrible.
Yeah. Thank you. And I think the last one that we've had, and again, this comes back to sort of, I think there's so much out there now. And although Google and Instagram and social media is a fantastic world to be in, it's also got its downsides. And it's after what do you believe out there if you read something? And certainly this week we've had some queries in around calcium supplements and their absorption. And is there anything you can sort of talk us through about that? And I think it's around whether or not they're useful.
I had a lot of messages from scared women when headlines hit the press saying that we shouldn't drink dairy, calcium supplements aren't absorbed, they can give you heart disease, and they don't have any effect on osteoporosis. And I've had a look at the research. So the papers that show taking calcium supplements increase the risk of heart disease were done on a study of women in the 1990s, over 20 or 30 years ago. They were taking a high dose of calcium that we wouldn't give today, and it said 30% increased risk of getting cardiovascular disease, heart attacks and strokes and angina. That sounds really, really scary. But this study looked at 1 million women. So the actual risk for one woman went up from 5.5% to 5.8%. That is a tiny, 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 tiny increase in your risk of getting heart disease. So you can forget that. The studies they were looking at were done on healthy women who did not have breast cancer, who were not on drugs to lower their estrogen, which we know increases your risk of osteoporosis. Those studies showed that we don't absorb high doses of calcium. They were looking at 1,000 milligrams, but now we give you 500 milligrams, and it's given together with vitamin D. It's all been, people are cherry picking data to make a point. Calcium vitamin D supplements are safe to take. They are important for anyone who is at an increased risk of osteoporosis, and that is anyone on an aromatase inhibitor, because if you break your bones, that has a lot of morbidity. It can also increase the risk of getting METs in the future if your bones are really, really weak. Ideally, you get all your calcium from a load of leafy green vegetables in your diet, but no one wants to drink kale smoothies every day. We know life is difficult. So a simple calcium and vitamin D supplement is safe. Don't get your medical advice from doctors on the internet, because the word doctor means nothing. You can be a doctor of biochemistry and have no training in oncology. And that's why it's really hard when there are doctors saying one thing and doctors saying another. And that's where you double check and you ask Breast Cancer Now or CR UK or another website, NHS UK. Are they all saying the same thing? If they are, then great. But if it's one lone person, you think, yeah, I'm going to ignore you until my doctor tells me something different.
Great. So for all those women out there taking letrozole or anastrol who are on a calcium supplement, it's fine to continue.
You need it. Also, when you lose estrogen, it lowers the amount of calcium you can absorb. So you need to supplement it with something in the diet to stop your bones getting weak.
Great, thank you. And just Nicola's just asked, because we spoke about turmeric, and she said, I'm on tamoxifen and really want to know, can I still eat curries with turmeric in?
Yes.
I love curry and just can't find the answer anywhere.
Turmeric is completely safe as a herb and a spice. I think my take home is there is no supplement that is going to cure you or stop your cancer coming back or magically make you feel better. And you could spend your money on really nice food or holidays or a handbag or whatever it is. They prey on us. We are the worried well with money to spend who want to do anything to stop it coming back. And there is nothing that can stop our cancer coming back, sadly.
Great. So moving on to diet, which again, if we go on the internet, you could be there for forever. And the conflicting evidence and information that is out there is a complete and utter minefield. We do our moving forward Q&As regularly at Breast Cancer Now, and diet is always on the agenda of questions. And certainly I think the biggest one is what can I eat after a breast cancer diagnosis, or what should I avoid after a breast cancer diagnosis?
And it's a great question, and one I never considered as a breast cancer surgeon, because I assume everybody knew what you're meant to eat after breast cancer. I had a paper in The Lancet earlier last year. There are over 20,000 cancer diet books on Amazon. 20,000, and a lot written by doctors who aren't proper doctors, by patients, with people with no nutritional training whatsoever. It is terrifying out there. I want to send you all, and I hope you can put a link later, to the World Cancer Research Fund, which is a global organisation that analyses every piece of dietary information out there. And cancer patients should be eating the same as normal patients, and it's really simple. It is a plant-based diet with a rainbow of fruit and veg and nuts and grains and seeds. A good source of protein, ideally limiting red meat if you eat it to 3 times a week. Processed meat, bacon, salami should be minimal, maybe 2 or 3 times a month, not every day. You do not need to take a supplement. You should reduce the amount of alcohol, and that's it. There's nothing fancy. Now, not everybody has ultra-processed foods. It's been a big thing recently, and half of our diet is made up of ultra-processed foods. You could say pasteurized milk is processed because it's been pasteurized. Butter is processed. Life is short, and we don't have the time, energy and money to have our meals cooked for us fresh every day. We've got kids, we've got husbands, we've got jobs. We're having cancer. There's no harm in having a ready meal or eating a fast food if you need it. And ideally, 80% of the time you'd eat well, but that's where the vitamins come in, just to help boost those things. There is no food you need to avoid or cut out of your diet. Everything is safe in moderation. You've had cancer. Sugar is completely safe. Sugar does not cause cancer, and you cannot starve your body of sugar. So everything you eat that is carbohydrate, fruits, nuts, seeds, beans, grains, they're all sugar, just like donuts and cakes and pastries. They all get broken down to sugar. And the Zoe apps and the glucose spike things are all BS. Your insulin normally goes up when you eat and normally comes down again. And again, it's people preying on the worried well. You don't need it.
Yeah.
Rant over. Sorry, Louise, but I feel really
right. Cancer Research UK has got some really good information. They talk about sugar on there as well. And I think, again, something that comes up so often when we have these the moving forward sessions is I suppose around the guilt. People are sort of saying, was this something I did? And if I'd not eaten all of those donuts, or I'd not done that, or I'd not drunk all of the alcohol, would I not have had breast cancer? And it's really difficult. And then there's people that want to go on really strict diets afterwards, and it's finding sort of that balance.
As a junior doctor, I joined a gym and never went. Exercise was a dirty word. I drank like a fish. The nights I cannot remember are huge. I mainly lived off beige food, bagels and cereals and cornflakes. I didn't cook. I was single. I was doing 14-hour weeks. I had a very unhealthy life. And I got breast cancer. And it's very easy to think, well, it's my fault because I drank and I didn't eat well, I didn't exercise. But actually, if you think of cancer like a spelling mistake and you need 10 mutations to happen, alcohol may have caused one, and eating crap may have caused another, and exercise may have caused another. But these other 7 kind of happened by chance. And that one may have been repaired. So although one thing you've done may have started that journey, lots of other things have to happen. So it is never your fault. We know thin teetotal people get breast cancer and people who are overweight and drink don't. A lot of it is bad luck. So please, please, please don't beat yourself up. A lot of people do juicing and detox diets to make them feel better. And often they do because they're suddenly eating a load of fruit and veg. But you cannot detox your body. Your body does it itself. It's what your liver, kidneys, lungs, bowel and skin do. Detoxing is bollocks to get you to spend money on things you don't need. If you like a smoothie, then that's great. The thing about juicing is there's no fibre. And you need fibre to boost the bacteria in your gut, your microbiome. It's really, really important. So if you're having a juice, there's no fibre going through. It's just the dangers of going on extreme diets can make you a lot more sicker in the long run and make you lose weight. And that weight is fat and muscle, and your heart is the muscle, and then your heart can start to get weak, and it's just this awful avalanche of malnutrition.
Yeah. Thank you for that. And just to say again, like you said, I don't think there's not this wonder diet that people need to do. It's just that healthy, balanced diet. And the World Cancer Research Fund, we've actually put, because they've recently opened a helpline around diet and breast cancer. So, and again, I'd ask Kev to put the link in. So again, we'll put the link into what you'd mentioned as well later on, because I think that would be really helpful.
Money. I could say, I don't like bananas, even though they're yellow. And I can say, I've never eaten bananas and I've cured breast cancer 3 times, so ban bananas and I'm going to make $1 million. But then someone could say, hang on, you've had breast cancer 3 times. Maybe if you'd had bananas, it wouldn't have come back. I could say anything and sell millions. I don't care about the people. I just want to make money. And that's what a lot of these people are doing.
Yeah, yeah. And I think just again, the final point is sort of I'll often get asked at sessions is should I go completely plant-based? Should I do this? Should I cut this out? Should I do? And I think as well, if people want to go plant-based, that's absolutely fine. But if it's going to cause them more distress or financially that's really difficult for them, I think it's just about doing something that's manageable and achievable for that person as well.
It's not going to stop the cancer coming back. So soy as part of your diet is completely safe. But when you have soy supplements, we worry because we don't know how much is in there, and that can increase the amount of estrogen in the supplements because they're not regulated. So soy is part of your diet, tofu, tempeh, edamame beans, completely fine. Maybe don't eat it 3 times a day, every day for the rest of your life, but stay away from soy supplements. And dairy, completely safe. It doesn't cause breast cancer. The book by Jane Plant, who said banning dairy cured my breast cancer, she actually had surgery and was on tamoxifen. It's not true. The hormones in cattle are negligible. Don't drink cow's milk if you don't like it, but you don't need to avoid it for the fear of your cancer coming back.
Yeah. And I think that sort of touches on, Helena was asking, is it true that estrogen receptor positive breast cancer, people with estrogen receptor positive should avoid certain foods?
No. There is no food you need to avoid. The phytonutrients in food, scary, tiny amounts, don't worry about it. And remember, if you've had surgery, you are technically cancer-free, no evidence of disease, if you don't have metastatic disease. There may be cancer cells floating around in your bloodstream that are fast asleep that will hopefully never wake up or be killed. So if you are on an extreme diet or you're avoiding soy because of these cancer cells, they're asleep, it's not affecting them, and you are depriving the rest of you of those essential nutrients. Have the cake, have the champagne if you want it. You know, it's 80-20. You've still got to have fun. Food should be fun. Actually, I have an online coach who's helping me get fit in the gym, and she says food should be, most of it should be fuel. A sensible, healthy, balanced diet that we eat to give us what we need. 20% of it should be fun, you know, the nights out, the popcorn at the cinema, and 1% should be, fuck it, I'm having a bad day, I'm going to eat a pack of biscuits, and I know I shouldn't, but I don't care. I don't want to feel my emotion any other way. You have to live your life. It can't be this stressful all the while.
And that's probably a good point, because Karen's asked, are we best to give up alcohol completely to avoid recurrence?
So we know that alcohol can cause breast cancer, but no one can say that was the cause of anybody's breast cancer. It can increase the risk of it coming back in 2 or 3 ways. One is alcohol are directly toxic to cells. Plus the excess alcohol that you drink gets turned to fat. And we know that the more fat you have, the more estrogen you produce, which can stimulate estrogen positive breast cancers. I think the current guidelines are to stay to about 5 units a week. Obviously, no alcohol is safe, and it doesn't matter if you have them all at the weekend or you spread them out through the week. I still have a glass of bubbly because I quite like the taste, although I hate the hangover. You don't need to cut it out, just everything in moderation. And ignore people who are telling you. I get death threats when I post a picture of me drinking champagne. How dare you? Well, I've had cancer 3 times. I enjoy it. I'm sensible. That's okay.
Yeah, and I think it's about it's not about an existence, is it? It's about quality of life.
You have to live.
If you want to have a glass of wine when you're out celebrating something or on a Friday night, then that's
if
your
it's part of your
choice to do
social
so.
life with friends and it makes you feel good, then go for it.
Yeah. And while we're moving from alcohol to matcha, I don't know, do you know anything about matcha, Liz?
Yes,
at all?
it's like
Somebody's
green
asking,
tea
is it
powder.
okay to drink whilst on
I don't think it
abemaciclib or
interacts with
exemestane?
chemicals. So I'm talking over you. I don't think matcha powder interacts with things, but I would direct you to the Memorial Sloan Kettering about botanicals and herbs because it can do. I think it's fine in small quantities if you have like a matcha green tea flavoured cake, but if you're drinking it as a powder every day, it could interfere. See, all these things that we don't know and we're relying on you to check and you don't know where to go, and it's really, really hard. There is so much out there.
Yeah, no, it's really difficult. And I think the final one is, and we've touched upon it again with the alcohol causing weight gain, is lots of people due to treatments can put on weight after a breast cancer diagnosis and find it a real struggle to lose weight. Any advice on that, really?
Firstly, this is really, really, really hard. I didn't get it as a breast surgeon. No, there's no myth that the menopause makes you put on weight. It doesn't automatically happen. I put on 10% of my body weight and I'm slim. I still went up a dress size, but nobody knew. But to me, that's still 10% of my body weight. That's 5 or 6 kilos more than I was when I was diagnosed. And I was exercising and eating well. Nothing had changed, but my weight had gone up and I suddenly got it. And when you're having chemo and the steroids and you're snacking all the time because you feel sick, it's really, really hard. And then you've got people like me saying, oh, you need to lose weight to reduce your risk of recurrence. So the impact on your risk of recurrence is small. It may reduce that risk by 20%, but if your risk is 10%, then that takes it to 12, not 10. It's a small impact. And not everyone who weighs more than they should will get a recurrence. But we know that it does increase the risk, and that is a hard fact, and it's really hard to hear. And it is damn hard to shift that weight. Diets don't work because you're restricting yourself and then you break. So ideally, if most of your food is a healthy plant-based diet and you can swap Mars bars for apples and try to eat healthy snacks, you can still feel full, but you're having better calories that your body will use. And try not to think diet. Exercise can help, and it's the last thing you want to do because you're knackered and your joints hurt, but actually it can help with those side effects and just moving more. 10 minutes brisk exercise a day. If you've got to take the laundry upstairs, do it sock by sock, so you're going up and down the stairs and getting your steps in and doing lunges and weights at the same time. Exercise can reduce the risk of recurrence by 1/3. It can also help you lose the weight. The biggest thing with the diet that worked for me and a lot of people is having more protein. I don't like eggs or oats or porridge or cheese. Having a protein breakfast is really hard. I might just have toast for lunch. It's very easy to have a very small amount of protein in the day. We should all be having around 30 grams at every meal, which is a lot. I use a chocolate protein powder, so I have a chocolate milkshake in the morning because I know I'm getting my protein. And when you're filling yourself with protein, you feel full. It helps build the muscles. It doesn't go to fat. So that is one thing that you can do to try and tweak the diet. It's hard to shift it, and it's maybe worth going to see your GP to see if there's advice they can help. We know, and I met one private surgeon who was sending all her patients to go and pay for one of the new weight loss drugs at 200 quid a month. Those are extremes, but you may get to that point where you've tried everything and you can't lose the weight, and it is really, really frustrating. But just doing those healthy habits can help. And I'm sorry the drugs do it to you. It's really, really hard.
Yeah. And again, it might be about sort of talking to your breast care nurse or treatment team about what they've got out there for sort of, they might have either exercise groups. And I know, again, we've talked about sort of going online, but there is a lot of access to, I know Future Dreams House is one of them, where they do some online sessions for exercise and seeing what's local in your area.
There's the Her Spirit app. which is a free online community that do challenges and how to run a 5K and how to start training weights at home. And we've launched a swimming challenge in June with Zogs to try and get you raising £20,000 of breast cancer now. There are cancer-trained personal trainers like Get Me Back UK and Carolyn Garrett on Instagram who are trained to show you what to do if you've got lymphedema or you've had arm surgery. There's a lot out there that you can access. And actually, when I exercise, I'm just Liz. I'm not a cancer surgeon anymore. I'm not a cancer patient. And it can be a really good way of making connections and just feeling it's not taken everything from me. I've got my life back. I've got my body back. I can still use it and appreciate it.
Yeah, great. I think I'm just seeing if there's any other questions that I don't. Again, this might be one that we need to look back on. Raspberry leaf tea, okay to take with tamoxifen. It might be one to check on Memorial Sloan Kettering. I've not been asked that one.
No, I vaguely remember people take it to induce pregnancy or to induce labour. I don't know if it's safe.
Yeah.
I think anything you're taking, you need to go and double check. And we'll put a link to the MSK website. But I would ask you, why are you taking it? What is it doing for you that you think you need that you could get from just eating more strawberries in your diet, whatever it is? Just think, why am I actually spending the money? Is it to make me feel better because I'm having a bad day? Or do I really believe it's going to help my inflammation more than going for a walk would? Just try and think, what is making you spend your money on that supplement, and is it really worth it? And is it really going to do what it says on the tin? Because most of them don't.
Yeah. And one, I think, got asked earlier that I missed, just saying, really appreciating that we're doing this Facebook Live. I have a seroma and lymphedema in my breast after surgery and radiotherapy. Holding up my next surgery. I'm doing massage and exercise and wearing a compression bar. Is there anything nutritionally I can help to get rid of this?
Seromas are a pain in the bum. When you remove the breast tissue, there's like a little envelope that can fill with fluid, and the body does naturally absorb it, but that can take weeks or months. And the thing is, if we drain them down, then they fill with fluid again. It's just a matter of waiting, and they're really annoying, and some take ages and they just heal, and I'm really sorry. I think just eating a normal healthy diet and taking a vitamin supplement if you don't is the best thing that anybody could do.
Take care. Bye.
Bye.